Hi everyone, I'm Wahanya Doc. In this video, I'm going to discuss about laryngitis. If you like this video and benefit from it, hit the like button, comment below, share, and subscribe. What is laryngitis? Laryngitis is the inflammation of the larynx or your voice box from either from infection, irritation, or overuse of the voice box. Laryngitis can manifest as acute laryngitis or chronic laryngitis. Acute laryngitis means that it is of abrupt onset and the signs and symptoms, the duration of signs and symptoms is short. For chronic laryngitis, it means it takes longer to develop, then it takes longer for the signs and symptoms to disappear. Most of the time, chronic cases may go beyond 3 weeks. Before I discuss about the signs and symptoms of laryngitis, I want you to understand the anatomical structure of your larynx or your voice box. There's this diagram here. This is the voice box. The voice box is located between the trachea. This is the trachea and the throat. It's located between the trachea and the throat. It is usually in the anterior aspect or the front aspect of the neck. The larynx or the voice box has several segments. The several segments have different functions. It usually contains one of the segments is the epiglottis. It has several. Your voice box has several functions. One of the functions we have, it usually participate in swallowing. Number two, it protects your lower respiratory tract airway by preventing or closing so fast, so it prevents foreign substances from entering the lower respiratory tract. In case a foreign substance, like when you are eating, when a foreign substance like food enter into the airway, it usually start or stimulate your cough reflex. You'll have a very persistent cough. The cough is trying to get rid of the foreign substance that has already entered into the voice box. Third, your voice box usually has the third function, which is phonation. Phonation is the production of vocal sounds and speech. As you can see, the voice box has these two folds. This one in red. These two folds of membranous structure that arise from the side wall of the voice box. These two folds usually are membranous in nature. They project downward, and in the center they form a slit. If you can see well, there's this white part is like a slit that has formed between these two folds. What happens when air is passing through? It makes the two folds or the vocal cords vibrate against each other, resulting into the vocal cords or the speech. Speech is a function of many structures. We have other structures that are responsible for speech. We have the tongue, we have the muscles around the throat, we have brain, and we have also the lips. As you can see, when you have a laryngitis or the infection or inflammation of the voice box, these two membranous become swollen and they become reddish in color, because sometimes you can have different type of infections. Most of the infections that cause laryngitis are one viral infections that are similar to those that cause your upper respiratory tract infections, like common cold flu. These viruses include rhinoviruses, we have influenza virus, we have influenza virus, we have respiratory syncytial virus, we have adenoviruses, and also we have mumps virus, we have measles virus. All those can cause infection of the larynx or your voice box. Also, we have other bacteria that can cause the infection of the voice box. We also have fungal causes and parasites that may cause the infection of your voice box. Other than infectious causes, we have one. We have when you have a cancer of the voice box, that one can also cause the inflammation of the voice box or laryngitis. We also have vocal cord palsy. This one is occurs when a patient has stroke. Other causes we have a condition we call GERD or gastroesophageal reflux disease. This is a digestive tract disease that when your stomach acid or your stomach contents they back up into the food pipe. This stomach contents or acid may end up reaching into the vocal cord, and acid will burn or irritate the vocal cord, resulting to laryngitis. Other causes of laryngitis, we have excessive alcohol intake, especially those people who take dry gins and whiskeys. And then we have people who have smoking. Smoking usually damage all the respiratory tract. And then we have irritants like chemicals or allergies and other stuff like that. What are the signs and symptoms of laryngitis? One, we have what we call hoarseness of voice. Number two, we have pain when you are trying to talk or to produce a speech. Three, we have aphonia. Aphonia is loss of voice. People with loss of voice, most of the time they try to talk by whispering. And then we have dysphagia. Dysphagia is difficulty in swallowing. We also have painful swallowing. We also have difficulty in breathing. We, we might also experience upper respiratory symptoms like sneezing, runny nose, and other other symptoms like what we say cough. Then we have other symptoms like headache, malaise, and fatigue. How is laryngitis treated or diagnosed? Laryngitis is diagnosed. Your doctor will ask you questions about your signs and symptoms. Your doctor also may also do a physical examination. Your doctor may also do laboratory tests or other procedures that will try to confirm whether you have laryngitis. How is laryngitis treated? Laryngitis is most cases of laryngitis are mild and self-limited. They can heal on their own, or you can recover on your own without taking treatment. But for those people who have chronic laryngitis, they may need prescription medications. They also may need alternative therapies. They also may need supplements. People who are smoking, they need to stop smoking. Those who are taking alcohol like whiskeys and dry gins, they need to stop that. And those are the main treatments. For complications, you may develop pneumonia and other systemic infection. This bacteria may move through the blood vessels and infect other systems of your body. I'm Mohinya Doc. For more content like this, follow and subscribe. Thank you.